Hello, friends and people of the world. Thank you for being here. I want to briefly discuss, I'll try to be brief. You all know I'm very detail oriented. I want to try to discuss what we have to do in an hour when you come to the dentist. We have lots of things to accomplish. When you come into the dental practice, we have 1 hour with you, and we have a lot to accomplish in that 1 hour. We always start out by checking your medical history. And I know there's a ton of people, this is irrelevant, whatever, it doesn't matter, it's not my mouth. Well, unfortunately, your mouth is inside and part of your whole entire body. If you're taking a medication, there is a side effect, and there can be a side effect, and there's hundreds of medications that a side effect of them affect your mouth. It's important to us. You can have an overgrowth of your gum tissue. You can have dry mouth. You can have a million other things that can happen from your medications. So, number one, when we ask to review your medical history, please just be honest with us. If you're going through cancer, radiation treatments, those can affect your mouth. If you've had a hip replacement, a knee replacement, any type of joint replacement, that can affect your dental visit, because according to your orthopedic surgeon, there could be a requirement for you to take antibiotics prior to your dental appointment. If not, if you didn't take those, there are some instances that it puts you at higher risk for what's called bacterial endocarditis. And what that is a blood infection, and it can be life-threatening if it was left go. So there are orthopedic surgeons that require that. There are orthopedic surgeons that require it for a period of time. And then there are orthopedic surgeons anymore that don't require it at all, because the science has changed so much over the years and it's constantly changing. That also goes for a heart valve replacement. That goes for a stent replacement. That goes for, like I said, artificial joints. Anything to do with your heart. There could be issues with pacemakers. Again, cancer, chemo, radiations. Some patients are not even allowed to get their teeth cleaned because their body's so immunosuppressed. This is full of bacteria. If we go to clean your teeth, we can cause an infection, and that infection could cause you to be very sick in the middle of treatment, trying to get rid of your cancer. Same with HIV patients, same with AIDS patients. Their immune system is so suppressed, if they're very severe and very sick, that something as simple as most people think, you're just scraping my teeth. Well, again, this is kind of a cesspool of bacteria. We're putting that in your bloodstream because you have capillaries that end in your mouth, in your gum tissue. There's blood supply that it's going to the teeth. So we do disrupt bacteria, and it does get in your bloodstream. Period. End of story. So, because no one does not have bacteria in their mouth, and there are very, very, very few humans that hardly ever bleed when they get their teeth cleaned. Far and few between. Everyone has at least one spot of bleeding. Well, guess what? That bacteria is going right in your bloodstream. So that's a concern. So what's the point of all of this rant of what I'm talking about, and can go into much detail about it? One, be honest on your medical history. Please have your medications with you. If you have a list of them, bring them in. We'll make a copy and we'll put it in your chart. We love that. Two, after we review your medical history, some of us take your blood pressure, some of us don't. If we do, please don't balk at us. We're checking your health. We're looking out for you, not me, you. If we're going to give you anesthetic, meaning we're numbing a part of your mouth, we need your blood pressure to be in a specific range, because when we put that anesthetic in, it raises your heart rate. And if you're at prone or risk, you have high blood pressure, you've had a heart attack in the past, we need your blood pressure to be lower, because we're giving you some medicine that's going into your body that's going to raise that blood pressure, and we want to keep it low. And we all know that everyone hates the dentist. Everyone's scared. Everyone comes in there with anxiety anyway. And we're trying to make it more pleasant. We don't need it scarier, but these are just things that we do. And a lot of people see that blood pressure cuff and they instantly panic and their blood pressure goes up. We're not doing it to scare you, I promise. We're doing it to check your health, because there have been many situations that a hygienist has taken the blood pressure on a patient and they have dismissed them from the practice and either sent them straight to the ER or sent them straight to their doctor. And we have prevented heart attacks in patients because patients had no idea that their blood pressure was that high. So my point is, don't dismiss it. So there's two things we have to do right there. We got to go over your medical history. We got to take your blood pressure. That can take anywhere from 30 seconds to 5 minutes sometimes. Sometimes it's taken 10. depending on what has happened with the patient that hasn't been in 6 months or a year. They could have had a lot of health scares and issues. Then we got to get you bibbed up. Some people, like me, I have you pre-rinse with some mouth rinse because, again, we're stirring this cesspool of bacteria in here. I'm trying to kill bacteria, so I put less in your bloodstream. It has nothing to do with your breath. It has nothing to do with me. It's to help you kill some of that crud in there before we disrupt all of it, okay? So we have you rinse for 30 seconds, get your bib on, get you laid back in the chair. We're going to do an oral cancer screening on you, checking under your chin, down your neck, around your floor of your mouth, your cheeks, pull your tongue out, look all around, make sure there's no lumps, bumps, no anything mischievous going on in there. After we complete that, if you're due, every year we take your perio charting. Sometimes we do it twice a year on patients, and that's where we take those measurements around your gums. I have a video on that. If you need to know about perio charting, please go watch that video. I'll link it below. But we measure those pockets. And again, if we have an assistant helping us, we can get that done in less than 5 minutes. If we're doing it on our own, it definitely takes longer because we're going back and forth to the computer. If we're charting all of the bleeding points, it just takes a minute, okay? So again, patience with us. If we don't have to do perio charting, sometimes we have to update your x-rays. We're checking for cavities. We're checking for things we can't see because we can't see in between your teeth and we can't see through your gum tissue because we do not have x-ray vision. But if we did, boy, we'd be crushing the world. We'd be the best superheroes on the planet. But unfortunately, we don't have that superpower. So again, these couple things, procedures, whether we're doing one or the other, anywhere from 5 to 10 minutes we can take. The less talking that we do, the faster we get these things done. So also, point of this is just be mindful when you're chatting with us. We love to talk to you. Don't get me wrong. We would love nothing more than to sit and talk to you. But our head is spinning of all these tasks that we have to do. And then we'll get through them all so you can kind of understand. So once we get your x-rays or your probing done, then okay, it's time. We got to start that cleaning. We have anywhere from 28 to 32 teeth, some less. Your max you can have is 32 teeth. Some people have less, some people have that amount. It just depends. Most people have on average have 28 teeth. On all 28 of those teeth, there's 6 surfaces. So whatever 28 times 6 is, you do the math. I suck at it. It's a lot of surfaces to clean. 1, we have to polish all your teeth. 2, we have to floss them. Then we have to take our ultrasonic instrument or our hand instruments, and we have to go around and we have to clean and remove bacteria and plaque and food and tartar from all 6 of those surfaces all around your teeth. Sometimes it actually could be 7 because some people build it on the tops of their teeth in the back. We have to go over that too because this is our job. So we have to go all around the tooth, down in those pockets that we may or may not have just measured. Remove all of the bacteria to make sure that we spick and span this up. So when you come in, you're like, I just want the fast, easy service. It's really hard to shrink down the time of cleaning. If we could make that process go faster, I'm telling you we would, but we can't. And when we're talking to you, as much as we love you, and sometimes the conversations are so great and they're needed. Sometimes those conversations are needed. Sometimes we need them. Sometimes you need them. I mean, it's amazing we don't all have degrees in therapy, psychology, because we could be therapists. We really could. We're like hairdressers. We've heard it all. And people confide in us things because we have a very close working relationship because we're working less than 2 feet from your face. So again, we're trying to clean over 300 surfaces on your teeth. Let's just throw that 300 out there. I could be wrong. I don't care. You want to fact check me? Go for it. But we have to do all that. And then our doctor has to come in and our doctor has to check your teeth. And then our doctor can chit chat with you. Sometimes our doctor's running behind. And then we have to dismiss you. And then once we dismiss you, we have to clean up our room, meaning we have to take all the instruments, all the paper products we used, throw them away. We have to disinfect the entire room and every surface that we touched. Then we have to do your notes and make a detailed description of every single thing we did today. And we also sometimes make personal notes as to what we talked about so that next time you come in, maybe we want to remember that you had your first grandbaby. Maybe we want to remember that you just lost a spouse or a family member or a friend. Maybe you're going off to college. Maybe you got your driver's license. Maybe you're going on a trip. Who knows? Anything good or bad, we want to celebrate with you. I mean, even though if it's not the greatest news, it's not that we're celebrating. It's just we want to remember because we want to ask, how are you doing? That's part of just who we are because that's what we're doing. We're taking care of you. So we have all of these tasks to do. And this is just if everything goes smooth. It's not like, the doctor comes in and I asked you in the beginning of your appointment, how are your teeth feeling today? Are you having any pain or discomfort with any teeth? Nope, everything's feeling great. Awesome. If my doctor comes in and you tell him different and you say, you know what, I'm having this pain over here and this is happening, and he looks at me or she looks at me and says, did you take an x-ray of that? And I go, no, I did not, because I didn't know about it. I know about it now. So halfway through the appointment, I have to stop, go grab the sensor, get the thing, take the x-ray, wait for them to the doctor to either leave and come back, or take it while they're sitting there so I can keep them there and just work really quickly and get this x-ray done in under a minute. It's just a lot of moving parts. So we do this on repeat all day long, all day long. Number one, we love to talk to you. Number two, all I'm asking you is be mindful of it. As in, I'll give you one example. Today, I had this patient come in and sit down. Wonderful, kind human being. I could tell, great soul, great human. Said to me 3 or 4 times, I talk a lot, and everyone tells me I need to stop talking. I talk a lot. And I said, he goes, I know I talk a lot. And I said, I want to let you talk because I want to hear about your health, but I will shut you up and we will get your cleaning done. And I said it to them that way, and I was very kind about it. But the patient knew we had to get to work. And I said, look, I need a solid 20 minutes to get your teeth cleaned, and we'll get that done. Because thank God they had great hygiene. I didn't have to work very hard to clean their teeth because they do really good at home. So I don't have to work really hard. If you don't work really hard at home, your cleaning time can double and triple, and it can suck up every second we have of that appointment. So it all depends on how clean or dirty your teeth are. I had a 20-year-old today, pristine home care, flosses, brushes, phenomenal. This other patient that talked a lot, knew they talked a lot, 80-year-old patient, phenomenal home care. And I mean that sincerely, because that makes my job easy. I can actually work faster. Now, if you don't take good care of your teeth, and I have patients that I don't, that are in their 70s or 50s or 30s or whatever, 15, 18, you name it. I've had them in all age ranges. If you don't take good care of your teeth, it takes me 2, sometimes 3 times longer to clean your teeth. So in that hour, instead of maybe me getting done in 20, 25 minutes tops to get your teeth cleaned, it can take me a solid 45 minutes, which gives me 15 minutes to get all the other stuff done that I need to in that appointment, because I need every second of that appointment to get the tartar and bacteria and plaque and stain off your teeth. So again, I'm not trying to be an asshole. I'm really not. I'm just trying to be realistic. And again, I'm not telling you to go into your doctor's appointment, one-word answers, like come off being a dick, but like, look, I just want to respect your time. I don't want to talk too much. I want to do your thing. You don't have to do that. If your hygienist is talking to you and they're engaging with you, engage all day long with them. But also please give them the freedom to get your teeth cleaned. And if they're talking to you about your home care at every single visit, and you know that you're not doing the things you need to, then take that as a hint, I guess, as to maybe you need to do a little bit better, or maybe you need to talk a little bit less, give them more time to do their job. So it's just a PSA. It's just intel. It's just, here's what goes on. And I can't record this stuff because of HIPAA. I can't violate patients' rights. So I can't have my phone recording me all day long of what's going on, because there's HIPAA in place and I have to protect the privacy of my patients. So their identity and their names, you're not allowed to know. The world's not allowed to know. If they come and talk to you, they can. I'm not allowed to talk to you about it. Even though I'm giving you some examples, they're very vague. And that's okay. But the point is, if you know yourself and you know your hygienist and you have a great working relationship, that's fantastic. If you don't know them very well, feel it out, work it out. But also, if you come in there and you're 5, 10, or 15 minutes late, you are putting our feet to the fire. And if we're running late, we're putting our own feet to the fire. But if you come in late and just do a really quick job, I don't care. Sometimes we're like, fine, screw it, we'll do it. Other times we have a lot to do and it really stresses us out. and it puts us late for the next patient. And sometimes when we're running late, that's why we're running late, because the person previous was late. Then we get behind 5, 10, 15 minutes because that patient was late. Sometimes we're waiting on our doctor because our doctor's in a procedure or our doctor had an emergency that they had to go tend to, and then they get in our room late, and then it kind of domino effects down. So there's a lot of situations that can happen that can cause us to run late. And if you think for 2 seconds that we don't care, you're wrong. We care heavily, and it weighs on us heavily, and it's very difficult for us to catch up on that. And we will stop doing some of the things we need to, like making our notes on every single patient. So we're not staying after work for sometimes 30 to 45 minutes to complete all of our notes on our patients from the day, so that we don't forget the next day, that we're doing everything, finishing the day, stopping, going home, and we're starting fresh tomorrow. So these are just things and scenarios and information. It's not like, hey, don't go into practice, don't talk to them. No, talk to them. They need to know things. We need to know about your mouth. We want to know about your personal life. It's just some things are irrelevant, and we're guilty of the same thing. I try to be very, very conscious of not speaking to my patients when my hands are in their mouths. And if I have a question come up, I'm like, oh, I want to ask him something. Then I will say, I'm going to ask you a question. Do not answer me until I take my hands out of your mouth, but I want you to think about this. And I say that to people because everyone feels obligated to answer, and everyone's response is, why are you talking to me with all this stuff in my mouth? Well, I'm doing that, but I'm not intentionally doing that. And most of the time we just want like a one-word answer. You can easily give a thumbs up or a thumbs down, and like, you can put your sunglasses on and your ear pods in, and we don't have to speak the whole time. And I'm okay with that because I have plenty of patients that do that too. I don't have a problem with that. It doesn't offend me. You are in tune with what you're doing, listening to what you got going on. Doesn't offend me. I get to do my job, and you're doing your thing. You're hanging out and you're relaxed. That's what we want. So it's just working with your hygienist, knowing them very well, knowing your dentist, but also kind of just being mindful of the time. Now, there are some hygienists that have 45 minutes, and there are some that have 30. And man, their feet are to the fire, and they are exhausted, and they have a very hard time staying on track. So don't be a dick when you come in if they're running behind, because you don't know what they're dealing with, and you don't know what they've dealt with all day long. When you're running late, we also try not to be an asshole, but we're trying to be respectful of your time. We want you to respect our time, but we also want you to respect the person that's coming in next that will be on time. So if you're a repeat offender to be late, stop doing it, or schedule it when you'll be on time. I don't know. The patients that show up early, it's fantastic. Sometimes, yes, we keep you guys waiting too. I mean, it's kind of a both side thing. And the whole point I started out this conversation was to tell you how many things we have to go through, and we have to do a lot, because we also have to clean. Like when I said, when we clean up our room, we have to go take our instruments into the sterile bay. We have to sometimes throw them in an ultrasonic bath. We have to do other things with other instruments. We may have to run a piece of sterilization equipment. That can take anywhere from 2 to 5 minutes. And back in our room, your notes can take 2 to 5 minutes. Your med history could take 2 to 10 minutes. Your x-rays could take 2 to 10 minutes, depending on what time we're taking, what type we're taking, and also how easy they are to take on your mouth. Some people have small mouths. Some people are gaggers. Some people just don't care. We just throw the stuff in. They do the things. They've done this a million times. Let's do it 1,000,001. It's a temporary suck. Let's embrace the temporary suck, and then let's just move on to something a little bit easier. There's a lot of information we're trying to gather because we're trying to be thorough, and we're trying to really take good care of your health. But when our feet are to the fire, we forget things. Things go along the wayside, and then that's when your health slips, and we're slipping. That's my PSA. I think I went on a good enough rant today. But any thoughts, throw them in the comments. Again, comment, like, subscribe. You can hear the dog back here in the background. He's quite a noisy guy, but he's entitled to that. He's old. He's like 12 years old. You're entitled to that when you're a dog and you're 12, because you're like, what, 80 something? He's an old man. There he is. Look at him. My old little Boston Terrier. Little man. Anyways, folks, thanks for being here. Appreciate the talk. I'll catch you on the next go round. Take care.